Welcome to Have More Babies.
Great to be here.
Today, we're looking into something really important, a genetic condition that affects kids and families quite deeply, cystic fibrosis.
That's right, CF.
Our goal, like always, is to kind of break down the key information, make it clearer, using a really helpful guide we found.
Yeah, absolutely.
We've been looking at this guide from Omega Pediatrics. It's called Cystic Fibrosis, the comprehensive guide to understanding and managing this genetic condition in children.
It really is comprehensive.
It's packed with info, and we want to pull out the most important pieces for you, try to make sense of it all.
And what's great about this guide, I think, is how it takes something that can feel, overwhelming
Definitely.
and lays it out clearly for
Yeah.
parents, for caregivers, really anyone curious. We'll touch on what CF actually is, how kids get it, what signs to watch for,
Right.
and the latest on diagnosis, and importantly, treatment. It makes you think, how can we best support families dealing with a condition like this day in and day out?
Okay, let's jump in there. The guide calls cystic fibrosis, or CF, a serious genetic disorder. So what's happening at the biological level? What's the main problem, and which parts of the body does it hit hardest?
Well, at its core, CF is caused by a problem with a specific gene, the CFTR gene.
CFTR.
Yeah, it stands for Cystic Fibrosis Transmembrane Conductance Regulator. Bit of a mouthful.
Mm-hmm.
Basically, this gene tells the body how to make a protein that controls the movement of salt and water in and out of cells when that protein doesn't work right.
Things go wrong.
Exactly. The body ends up producing this mucus that's way too thick and sticky.
Ah, the mucus. I've heard about that.
Right. And it's not just like in the nose. This thick mucus causes blockages and inflammation in several organs. The lungs are a major target, leading to persistent coughs, infections, progressive damage over time.
Okay.
But it's also a big problem for the digestive system, especially the pancreas.
How so?
The mucus blocks the little tubes, the ducts, that release digestive enzymes. So the body can't break down food properly or absorb nutrients,
Wow, even if the child is eating okay.
even if they have a great appetite. Yeah, it can lead to poor growth, malnutrition. It also affects the liver, sweat glands, even the reproductive system later in life. It's quite systemic.
That sticky mucus sounds like a real challenge across the board. So if it's genetic, how does a child actually end up with CF? How does inheritance work here?
Good question. This is all about genetics. CF is what we call an autosomal recessive condition,
Meaning?
meaning a child has to inherit 2 copies of the faulty CFTR gene to actually have cystic fibrosis. 1 copy has to come from the mother and 1 from the father.
Both parents have to pass it on?
Correct. If a child only gets 1 faulty copy, they won't have CF themselves, but they'll be a carrier.
A carrier, so they could pass it on later.
Exactly. They carry the gene mutation. And the guide points out the odds, which are important for families to understand. If both parents are carriers,
Okay.
then for each pregnancy, there's a 25% chance the child will have CF.
1 in 4.
Right. There's a 50% chance the child will be a carrier, like the parents, and a 25% chance the child will be completely unaffected. No CF, not a carrier.
Those odds are significant. It really highlights why genetic understanding, maybe even counseling, is so key for families.
Absolutely. It's crucial information for family planning.
Okay, so knowing how it's inherited, let's talk symptoms. If a parent is worried, what are the common signs the guide says to watch for? I know some can seem like regular kid stuff, but you mentioned one that's quite unique.
Yeah, distinguishing symptoms can be tricky, but the guide gives some key pointers. First, a persistent cough. Not just a cold, but a cough that hangs around, maybe produces thick phlegm.
This doesn't clear up.
Right. Then frequent lung infections are a big red flag. Things like bronchitis or pneumonia happening over and over.
Because the mucus traps germs.
Precisely. It's a perfect breeding ground for bacteria. Another sign is poor growth or difficulty gaining weight, even with a normal appetite. That goes back to the pancreas issue, the problems absorbing nutrients.
Makes sense.
And then, the really distinct one, salty tasting skin.
Salty skin. How would you notice that?
Parents often notice it when they kiss their baby or child. Or maybe the skin feels kind of gritty after they sweat.
Huh. Why does that happen?
It's because that faulty CFTR protein also affects the sweat glands. They can't reabsorb salt properly, so more salt comes out in the sweat. It's actually a very specific indicator for CF.
Wow. That's fascinating. A small detail, but so important.
It really can be an early clue. The guide stresses, though, that if you see persistent symptoms like these together, definitely seek medical advice. Don't just assume it's another cold.
Right, professional consultation is key. So if CF is suspected, how do doctors confirm it? What tests does the guide mention?
Okay, so diagnosis. Thankfully, there are reliable tests. The main one, kind of the gold standard for decades, is the sweat test.
The sweat test, like testing, sweat.
Exactly. It's simple, painless. They collect a small amount of sweat and measure the amount of chloride, which is part of salt.
And if it's high?
If the chloride level is significantly higher than normal, it strongly suggests CF, because the issue with salt transport we just talked about.
Got it.
Then there's genetic testing. This looks directly at the child's DNA for mutations in that CFTR gene.
Can that tell you more?
Yes, definitely. There are actually thousands of known CFTR mutations. Genetic testing can confirm the diagnosis and sometimes even give clues about how severe the condition might be or which specific treatments might work best later on.
Okay, so sweat test, genetic testing, anything else?
They might also use chest x-rays to look at the lungs, see if there's any damage or signs of infection. And as kids get older, lung function tests, also called spirometry.
To see how well the lungs are working.
Exactly. How much air they can breathe in and out and how quickly. The guide really emphasizes that getting diagnosed early, often through newborn screening programs now.
They screen babies for this.
Yes, in many places. And that early diagnosis is critical. It means treatment can start right away, which makes a huge difference for long-term health.
That's good news about newborn screening. So once it's confirmed, what's the approach? The guide mentioned management. Is there a cure?
That's the tough part. The guide is clear. Right now, there isn't a cure for cystic fibrosis.
Okay.
But, and this is a really big gig, but treatments have improved dramatically. So much so that life expectancy and quality of life have just soared compared to a few decades ago.
That's encouraging.
Definitely. The focus is on managing the symptoms, preventing complications, and helping people with CF live fuller lives. It requires a pretty intensive lifelong approach.
What does that involve day to day?
It's multifaceted. Medications are key. There are drugs to help thin that thick mucus, making it easier to cough up. Antibiotics are used frequently, both inhaled and oral, to fight off the constant threat of lung infections.
Makes sense.
And anti-inflammatory medicines to calm the inflammation in the airways. Plus, because of the digestive issues, most people with CF need to take enzyme replacement capsules. Yet, pills containing the digestive enzymes their pancreas isn't releasing properly. They take these with every meal, every snack, to help digest food and absorb nutrients.
Wow. That alone sounds like a big commitment.
It really is. And that's just the medication side.
What else is involved?
Physical therapy is absolutely crucial, specifically airway clearance techniques.
To get the mucus out.
Exactly. This can involve things like chest physiotherapy or CPT, where someone claps on the person's chest and back to loosen mucus, or more commonly now, special vibrating vests that do the same job.
Like a machine shakes the mucus loose.
Sort of, yeah. It helps mobilize it so it can be coughed out, plus breathing exercises. And then there's nutrition.
Right, you mentioned the absorption problems.
Yeah. So people with CF typically need a diet that's very high in calories and fat, much higher than average. And they usually need to take extra vitamins, especially the fat-soluble ones, A, D, E, and K, because they don't absorb fat well.
High calorie, high fat, enzymes, vitamins, airway clearance, meds.
That's a lot. It is. It's often hours of treatment every single day. The guide really brings home that this is a lifelong commitment that shapes daily routines, family life, everything.
It sounds incredibly demanding, not just physically, but emotionally, too. Does the guide touch on that aspect, the toll it takes?
Well, absolutely.
Okay.
It makes a point of acknowledging the emotional drain. It's not just the time spent on treatments, but the constant vigilance, the worry about health, hospital stays, school, social life, the financial strain.
I can only imagine.
The stress can be significant for the person with CF and the whole family. And that's why the guide highlights the importance of support systems.
Like what?
Support groups are invaluable, connecting with other families who understand what you're going through. And mental health services are presented as a really key resource, too. Addressing the emotional and psychological side is just as important as the medical treatments.
That holistic view seems essential. It's good the guide emphasizes that. Looking ahead then, despite the challenges, is there optimism? Does the guide talk about hope for the future?
Yes, definitely. There's a strong sense of hope. Research is ongoing, and new treatments are constantly being developed. The biggest game changer recently has been a class of drugs called CFTR modulators.
Modulators? How are they different?
Unlike older drugs that just treated symptoms, these modulators actually target the underlying problem, the faulty CFTR protein itself.
They try to fix the root cause.
Exactly, or at least help the protein work better. For many people with specific gene mutations, drugs like Trikafta have been revolutionary. They can lead to significant improvements in lung function, fewer infections, better weight gain, really boosting quality of life.
That sounds like incredible progress.
It really is. And the guide also mentions ongoing research into things like gene therapy.
Trying to actually fix the gene.
That's the ultimate goal, yeah. Offering hope for maybe a more permanent solution down the road. It shows the dedication of researchers in the CF community constantly pushing forward. The whole narrative around CF is shifting because of these advances.
From just coping to actually thriving more.
Precisely. Enhancing and extending life in ways that weren't possible before.
So, wrapping this up, what's the key takeaway for our listeners from all this?
I think understanding something like cystic fibrosis isn't just about knowing the medical details. It's about building empathy, right? Recognizing the signs, knowing where support can be found, and appreciating the immense commitment families make.
Right.
But also recognizing the hope. The advancements are real. They're changing lives. It really makes you think. As science keeps moving forward, how will our whole concept of a lifelong condition change in the future? Could it become something much more manageable, maybe even curable one day?
That's a powerful thought to end on. The landscape is definitely changing. We really hope this conversation has helped shed some light on cystic fibrosis in children, drawing on that excellent guide from Omega Pediatrics.
They really do have great resources.
They absolutely do. If you want to learn more, get more details about CF, or explore other pediatric health topics, we highly recommend visiting your website. It's omegapediatrics.com.
Definitely worth checking out.
Lots of valuable information there. And if you found our chat helpful today, please do give this video a thumbs up.
It helps others find it.
It really does. And subscribe to our channel for more conversations like this. Maybe share it with someone you think might find it useful.
Spread the knowledge.
Exactly. Thanks so much for tuning in to Have More Babies.